Welcome to Radiologists, a podcast by University Medical Imaging Toronto, where we discuss the most interesting topics through the lens of Canada's largest medical imaging department. I'm your host, Satheesh Krishna. Medicine is magical. Medicine is one of the most magical things you can do. In fact, throughout history, doctors were considered magicians. Diseases were considered to have been inflicted by evil spirits, and doctors, or medicine men as they were called in the old days, were considered to perform white magic, and they were held in high regard. Now, magic has been replaced by science, but still that awe and reverence still holds good. What I'm trying to say is that learning medicine is like learning magic. And in that sense, going to med school is one of the closest things you can do to getting into Hogwarts. One thing you would have noticed in the Harry Potter universe is that all the students in Hogwarts, they stay in Hogwarts to learn. They reside in Hogwarts. Similarly, after med school, you undergo something called residency training. Although the name residency comes from when you had to reside in the hospital, it's no longer the case, but still, the impact of that still holds good. Similar to how in Hogwarts, the residents were divided into different houses, House Gryffindor, House Ravenclaw, House Slytherin. There are multiple residencies in medicine. There's residency in medicine, in surgery, and, radiology, which we're here to talk about. The success of all these houses in Hogwarts depended on the venerable heads. Who can forget the legendary Minerva McGonagall or Professor Snape, the heads of Gryffindor and the heads of Slytherin? For radiology, we have Dr. Rachel Fleming, breast radiologist and the program director of the Residency of Radiology in the University of Toronto. We are very grateful to have you here, Rachel. Welcome.
Thank you so much for having me. I'm excited to be here.
All right, so let's begin with one of the most obvious questions first. In the Harry Potter universe, in Hogwarts, when the students come in, they are placed a sorting hat over their head, and the hat tells them which house they belong to. You belong to Gryffindor, you belong to, Slytherin. The only exception was Harry Potter, of course, and he decided where he wanted to be. Whereas in medicine, it's the other way around. There is no sorting hat. Students have to decide for themselves as to which residency they want to take. How do students do that? Because it's always a shot in the dark. How do you think medical students can figure out if radiology is the right fit for them?
Yeah, that's an interesting question, Satheesh. I think if we had sorting hats, it would be a lot easier for everyone. But, I think exposure and, the biggest thing I think is keeping an open mind when you're a medical student and trying on each of the different rotations that you rotate through with an open mind to see if you think it would be the right fit for you. Another thing that residents can do is shadow. They can shadow clinicians in various subspecialties, and that gives them a little bit of a hint of, what the job would actually be like when they were done residency training. Talking to the residents within the different subspecialties is a great way to figure out, the things that they like, the things that they find challenging. And in that way, medical students can sort of analyze for themselves if a particular subspecialty would be a good fit for them.
Yeah, I do understand that's pretty tricky. It's like watching someone else play chess. You don't quite understand what it is unless you're in the seat playing chess yourself. So I understand how it can be challenging, but you point out that the more they get involved, the more they talk to the radiologists, the residents, the fellows, the more they do observership and the more interest they show and read about it, they probably get a better idea to see if it is suited to them or not. So let's say that they decide to take up radiology. And there are radiology residency programs, not just in Toronto, but in most major academic centers across Canada and the US and across the world. So when students decide to take on radiology, what other factors do you think they need to consider in deciding what program is best suited for them?
Yeah, I think that's very individual. I think, all of the programs across the country would give residents a great education and, great training in order to become radiologists themselves when they're finished. So I think really it's about finding maybe what fits best for them. And some of that comes in the way of support. Some medical students will choose programs because they have family in the area. Residency training is obviously very difficult and stressful and a lot of time, and having the right supports in place, I think just helps residents be successful. So, location and family either support or friend support in the area, I think would be important to choose. And then, there's some other things like, some people may be more geared to a smaller environment. Some people might thrive in a big city. Even though residency takes up a large portion of a resident's life, there is other things, there is some downtime. And, for Toronto, there's, amazing things in Toronto that residents can do when they're not working and not studying. So that may be a factor. But I think from an academic point of view, obviously each program has their own sort of, strengths and weaknesses and nuances, but they're all going to provide residents with the appropriate training. So then it's kind of teasing out those little things that might be really resonant for the individual medical student.
Yeah, I agree. But I think that still the name of University of Toronto and the branding behind it still has a huge pull. And I think that we probably attract the biggest group of applicants. And I'm assuming that the process is very competitive, in which a large amount of medical students do apply. Only a small handful end up getting the residency spots because we just have a small amount of residency spots. So how competitive is getting into the program? And let's say a medical student wants to get into the program and they want to get into University of Toronto at any cost. What's the best way for them to get noticed and ensure that they kind of get a spot here?
Yeah, actually, Satheesh, you're right. Radiology has always been quite competitive. But last year in CARMS, all of the programs across the country saw, a doubling of applications compared to previous years. So, we historically across the country fill all of our residency spots for diagnostic radiology. And based on the number of people who applied, there definitely were a lot of people who wanted to apply to diagnostic radiology and were unfortunately not successful. And it's simply because across the country, we don't have enough spots for the number of qualified applicants. So CARMS is actually one of the hardest parts of my job. I find it really, really difficult because at the end of the day, it's really hard to, everyone is of such high caliber. I think all of the staff that I work with would say something like, I wouldn't get into residency now if it, because the people that are coming up are just so qualified. For our program specifically, I think all the programs look for different things, but for Toronto, we really take a holistic approach at looking at the candidates. So we look at all aspects of their, application, their life. We don't really focus heavily. I think there's a big myth in that University of Toronto is purely research focused, and we only take people who, want to see themselves as, the leading researchers in the country. If you pulled the current resident group, that couldn't be further from the truth. We just, we really are looking for well-rounded individuals who have a passion for diagnostic radiology, who are interested in serving their community. We do look a lot at what people have done in their past, their volunteer work, and, things that are outside of kind of their own personal domain. We really try to recruit people who will be good colleagues, good future colleagues for all of the, staff that we people that we work with. And it's very difficult. The selection process is very, very difficult. And I think most programs now are also going to kind of using a rubric of sorts to try to make things as standardized as possible in terms of, fairness in the file review portion of the selection process. But it is very, very difficult. And, the biggest advice I guess I could give medical students when applying for residency is, tell us your story. What we notice in CARMS is that the stories are very similar. Oftentimes, you'll hear the same things over and over again. And I think there must be some element of CARMS interview coaching that happens at the medical schools. But it is interesting that you do hear a lot of the same things over and over again. But really, we're interested in the individual. We're not interested in a formulated set of answers to fit into some type of box. We're really looking for unique individuals who will add depth to our program.
So speaking of very unique individuals, and especially because you have one of the largest programs, I'm assuming that they come from all across the place and they have quite diverse backgrounds, right?
They do, actually. We're quite fortunate at the University of Toronto to have quite a diverse resident body. It's definitely something we look for in our application process. And it's mainly just because I think, there's a lot of data to show that teams function better when there's diverse backgrounds, diverse viewpoints, and diverse ideas. And I always find it really interesting to hear what people have done before in their lives. I mean, it's fascinating to hear the amount of growth people have gone through to get to the point of sitting in front of you, with a screen in front of you now because of Zoom interviews. But, especially we have a CMG pool. So that's for Canadian grads. And then we have an IMG pool, and that's for internationally trained medical graduates. And we also take sponsored trainees as well. So we have University of Toronto has agreements with particular countries who actually send their residents here for training. And so that leads to us having residents who come from all different parts of the world, which I think is a really great asset to the University of Toronto.
I think it embodies the spirit of Toronto because Toronto is kind of the melting pot of the world where we have people from everywhere. And I think it's reflected well in our residency as well, in which we have people from literally every part of the world. I was interested when you were talking about research in residency. And as you rightly point out, there's this common myth, not just among residency, but even in the fellowship level and as a staff, that University of Toronto or University of Medical Imaging Toronto, we only want researchers. And in many of our previous episodes, we've been trying to highlight this as research is not the only thing. In fact, if we just have a group or a bunch of researchers, we can get nowhere. We need the right mix. We need the right mix of good quality clinicians who try to push things in that. We want great advocates. We want people looking after quality. We want great administrators, amazing leaders, and then have researchers as well. And only, as you point out, that diversity of team, that's what makes the team function and not just research. But for some reason, we do seem to attract people who love to do research. And I think it's part of that academic curiosity because research answers questions and people whom we attract are very interested to know the hows and the whys. So when residents are interested in research, how can they get involved in research in the residency program?
Well, all of the residents are required to do a research project, and that's a Royal College requirement. There has been some flexibility introduced where a substantive educational project could count as the research component, as well as QI projects, which is becoming increasingly more important and popular. But everyone is required to do a research project. And there's some people who, want to do kind of the bare minimum, tick the box because it's a requirement and move on. But there's lots of other people who are very interested in research. And, it can be daunting at the University of Toronto because there's such a big faculty and most residents ask me, where do I start? But the benefit of being at the University of Toronto is you have the ability to find someone who has your same interests. We have such a diverse faculty, and they have interest in all of our different subspecialties as well as extremely niche areas. So I think residents are really fortunate here at the University of Toronto to be able to find faculty mentors who have similar interests to them. And really, it's about looking at what the residents are most interested in and kind of trying to interact with those faculty to see if there's a common interest or if the faculty has a project on the go. Many residents will get involved in multiple different projects in various different levels of responsibility. So for their academic requirement, they do need to have a project that's sort of theirs, that they're going to be the primary author on. But they get involved in a lot of projects that are going on throughout the department. And that's a great way to figure out, one, if the subspecialty is something that they're interested in, as well as start to build their CV.
You pointed that out really well, because the subspecialty of radiology has become so mature that it's difficult for residents who are just jumping in to have new ideas to push the field. And that's where all the faculty come in, because we are in it and we do a lot of these projects. So at least in my mind, when I was a trainee, I didn't realize this, but now I realize that the first few projects I did was not really for research, but it was really valuable for the mentorship. It teaches you how to think, how to set up a project and how to go about it, how to find these like chinks in literature. And for that, it was really, really valuable. And I think that that's where there's a lot of learning to be had, because radiology is a very unique specialty because we don't have a lot of exposure to it during our med school. We talk about all medicine and surgery and stuff like that, but radiology, it's not that well known, and medical students don't know what to expect. So there's that initial steep learning curve. So how do you support your residents when they kind of start out in this new subspecialty and they don't know what to expect, and it's quite a difficult, how do you ease them into the program?
Well, that is a really good question. We have a lot of orientations for our new PGY1s to come in. We have a couple of different things. So we sort of talk to them about the program generally. The biggest thing for residents when they first start, I think, is knowing how and where to get help. So they know they can contact me as the program director or the program office. Our chief residents are amazing and very available, and they are huge supports to the new PGY1s that come in. And also the resident body generally. I mean, I think our resident body is obviously it's quite large. We have the largest program in the country, but there's a lot of interest in mentoring junior residents from senior residents. There's a ton of advice that gets passed down. And so I think the residents feel, well, you'd have to ask them specifically, but I feel like they feel quite supported when they start. The other way that they're supported is we do have a gradual entry into our call. So as most people know, most of our PGY 1 year is actually off service. So they are on medicine and surgery and emergency medicine, obstetrics, and they rotate through all of those things. And they do have, now we've just started, they are getting 4 blocks of radiology in their PGY 1 year. So this is the first year of that. It's very exciting. And so I think they're going to be better able to transition into PGY 2 where they really start in radiology. I think those extra 2 blocks will help them in PGY 1. And then we do have a graduated call situation. So residents will start out with shadow call. So basically they have, no real responsibilities, but they're kind of buddied on to a senior resident and shadow them for the entire shift of their call. They get to see workflow, they get to see pressure points, they get a lot of advice from the senior residents as they're taking call. And then we go into buddy call. And buddy call is where the junior resident will then take over much of the responsibilities, but they have someone right beside them for backup. So if there's questions, if they don't know who to call for something, if they're not sure what the protocol is, they have that backup. And then, we kind of gradually withdraw some of the immediate support. But the nice thing about our program is that at all sites, there is multiple levels of support while people are on call. So they never have to feel like they're there by themselves. At some of our sites, they have 24-hour staff coverage. At other sites, they have 24-hour staff coverage, but it's remote. All sites have fellow coverage. So there's multiple layers of coverage. So I think the residents feel quite supported when they're on call.
That's great to hear that residents are not just pushed off into the deep end and, shouted, hey, learn how to swim. It's great that they have all this support available to them in every step of the way, not just in academics, in research, and even in call. And speaking about call, that's, I think call kind of embodies the spirit of residency, in which they stay here and they take care of things by themselves, which I think originally that's how residency was intended to be. And residency can be very demanding and very intensive. And what is your advice to people starting off residency? Because on one hand, it is very, very intensive. There's so much to learn. There's like so much learning curve ahead. And a considerable amount of time needs to go into that. But on the other hand, most people, they also have life. They have other responsibilities outside. How do they balance it? Or do they need to even balance it? Do they need to just jump into residency, forget everything for the next, 4 years? And then, once you come out, you're like, okay, fine, now let me go on with your life. Like, what's your advice there?
Yeah, it's, honestly, it's really difficult. It's not just the demands, but it's also that residency is a really kind of a weird mix of, on the one hand, you're a learner. And you're considered a learner by the postgraduate medical office and by us. So you feel in some ways like a student, but you're actually a worker too. It's basically like an old apprenticeship model where you're learning on the job. And that gives, I think, the best ability for people to really grow their skills in on the job, learning and training. So there's that kind of pressure point. And then there's always the pressure point of, of course, residents are human beings. They have lives outside of residency. And I hope, as time has come on, I think that we've all evolved a little bit in our thinking about the self-sacrifice that needs to happen in medicine generally across the board. I mean, I think it still has some way to go maybe. And part of that is just the nature of the training. It is intense and it has to be intense in some ways. But I'm hoping that medicine in general has become a little bit kinder to the individual in terms of knowing that they do have lives to lead outside of that. I think at the end of the day, residents really need to approach residency. It's a marathon. It's not a sprint. So, you need to pace yourself, especially in radiology. The amount of knowledge you need to acquire is immense. And that does not come overnight. It takes a long time. So you really do need to pace yourself and chip away. And maybe it's that you carve out, 30 minutes or an hour a day to study on topics that you learned about that day. Maybe it's, working with peers, other residents. A lot of residents will form study groups and they'll get together. And I think, the biggest thing is leaning on your supports. Your resident body is a support. Obviously the program's a support, but your friends and family are support. You need to build in downtime. Make sure you take breaks because like anyone, you need that time to recharge. And there's going to be times where it's less easy to do that. And there's going to be times when it's more easy to do that. But I think the residents who are successful do have kind of an eye on the big prize. They really value their time at work. They're engaged at work. And if you can be engaged at work on service and really pitch in to the daily work, that's where most of your learning is going to come. And you're going to need less. You're still going to need to study at night, obviously, but it's going to be more intuitive for you and you'll need less of that. The other thing that we have in our program, we have a wonderful social and wellness committee, and they are charged with planning social events for the resident body. We have 2 retreats per year, and we actually just had one last week, our summer retreat, where there's some academic, usually non-medical expert content in the morning, and then they have a social aspect in the afternoon. And it's a really great time for residents to be able to get together with people in their class, but also get to know people in other classes. Oftentimes it's kind of the one time to do that. The other thing that our department did this year is the university department. We had a welcome barbecue in July. And there was a very good turnout of residents, of new fellows, of staff. And it's a great sort of informal time to be able to get to know people, mingle, and just kind of have some fun outside of the hospital.
Wow, I'm almost jealous. Residents have like a welcome barbecue and 2 social retreats. I still remember my residency. The very first day, my chief and program director, he took us, all our new residents, into his room. He got us coffee and he said, today is your first day. You get a coffee on your first day. On your last day, you're going to get a coffee and no coffee in between. You just work. That's what he said. And it's great to know that here they have all sorts of social events planned for them. In residency, again, it's a new point of time. It's a new adventure. And we all make mistakes. And I, kind of looking back, made a lot of mistakes during early residency. And now looking back, it's just very obvious. But when you're there, you kind of don't know what to expect. And you have seen a lot of these residents because you've been doing it for a while. So what do you think are some of the most common typical mistakes which residents make? And what advice do you have for residents to avoid them and fall into those pitfalls?
Well, I think it depends on the type of mistake. So, I mean, we're all human. We're all going to make mistakes. And in radiology, even as staff, we make mistakes. And I think normalizing that and understanding that when you make mistakes in your clinical work, unfortunately, despite our best efforts, they do happen. And that gives you an opportunity to learn and to grow and to get better. So I think if you didn't make any mistakes, you'd be stagnant. There would be no growth. And obviously, no one wants that. So there is a level of, you are going to make mistakes and you have to be okay with that in some ways. What I think, just in terms of like more process things, I think the biggest mistakes that residents make, and we talk about it a lot, is not taking advantage of all the opportunities that they have. So, and that really means, I think, because in radiology, there's so much content knowledge to know, the residents get very overwhelmed. And I mean, I think you probably remember it too. I certainly remember feeling very overwhelmed with just the scope that you needed to learn to be able to pass the exam. And the mistake is not to think bigger picture than that. So, of course, the Royal College exam is extremely important and it's a hurdle in your way. But you're not doing your residency to be able to pass the Royal College exam and study all the books. You're doing your residency to be a good radiologist and be able to provide good patient care. So I think the biggest mistake that I see residents make is, trying to be perfect. So not taking risks, not pulling the hard cases. We know, as staff, we know what are the hard cases. We know if there's been good effort on a hard case and that maybe it takes you a little bit more time, and that's okay. But I think residents who really want to look good all the time are going to miss those opportunities for growth. They're not going to pull the challenging cases. And I think most of us can remember a time where we wish we'd done something as a resident, because then when you're staff, you have to do it and you may not know how. And residency is a great opportunity to take all of those experience and say, I don't know how to do this. And that's where you get training and coaching. So I think residents really need to take advantage of, all of the experiences on the job has to offer, even if it's something small. Like sometimes residents will shy away from answering the phone because they don't know what the answer is going to, they may get asked a question they don't know the answer to, but that gives you an opportunity to ask. And you can just say, you know what? I don't know. Let me find out for you. And then you ask the staff or the fellow, and then you've learned something then. So even with things that are seemingly not learning experiences, like answering the phone, doing some protocoling, like those kinds of things kind of feel like busy work that doesn't contribute to our education. But if you actually think about it, all of those things do contribute to you becoming a better radiologist when you get out.
That's great advice. I don't think that is just applicable to residency, but that's applicable to everybody across what you're doing, residency, fellowship, staff, not just in medicine, everywhere. Because the more you try to show that you know stuff, the less new things you're going to know. The more you keep saying that, hey, I don't know, how do I know better? And the more you listen, you're going to know more skills. And down the line, you are going to be much, much better than what you are right now. And that's always what you want, to kind of improve along the way. So you were talking about residents that they should ideally see the bigger picture, not just the exams, but in what type of radiologist they want to be eventually. And you were saying that when the residents come in, they have all these support systems to help them transition into residency. What kind of programs or what supports do they have in the next phase of their career? What do residents typically do after their residency program?
So pretty much all of our residents, with the rare exception, go on to do a fellowship in some type of subspecialty training. And most of them will then actually practice in community settings. So even though, historically people have thought that community settings were completely, generalist, really all of the community settings now have subspecialty trained radiologists. And while they're reading in their own subspecialty, they are also reading in other subspecialties. So I think residents now realize pretty much exclusively that fellowship is a real way to hone in on a particular area, understanding that you may do that exclusively as an academic radiologist, or you may do that really well in conjunction with other things as a community radiologist. But I think it gives them an opportunity to see if they would like life as an academic radiologist, as a fellow, because the workflow and the work generally is a little bit different as a resident compared to as a fellow. And I think as a fellow, you get the experience a little bit closer to what it is like to be a staff. And so it gives them a great opportunity to experience that.
We were speaking with Dr. Minnie Packle the other day, and she was telling about the same thing, in which fellowship programs are getting more competitive. And for our listeners, if you want to know how to transition out of a residency and get into the fellowship of your choice, we urge you to listen to that podcast episode by Dr. Minnie Packle. But Rachel, I have a question for you. So residents, they are eased into the program, they are helped transition out of the program. But how did you transition into this role as residency program director? And in this role, you're dealing with a lot of residents. It's almost like dealing with a lot of kids, right? Like, it is, I'm assuming, fulfilling, but then it can also be frustrating. What are your thoughts about your experience and your time as a residency program director?
Well, I really did want to be program director for a long time. Even as a resident, I had a very good relationship with my program director when I was a resident. I really thought he was very supportive. He was a mentor to me. And we're still in touch actually now. And he had a different outlook than some of the other people. You're speaking about your experience, and I remember the very first week of radiology residency, and I trained in the US, so I did a separate intern year and then radiology separately in 2 different states. And he asked my friend and I, who are both PGY1s, after the first week, what's the most important thing to do this weekend? And the 2 of us are like, okay, study abdomen, study chest, study neuro, study everything, and we were thinking about all these things. And he's like, go do something fun. And I just thought he really had a great outlook on what balance, should be, and encouraging us to remember that it's a long haul. And so I really think about him a lot, and I really valued our relationship. And so it was something that I wanted to do when I came here to Toronto as a staff. I got a lot of good advice and guidance and mentorship from our previous program director, Dr. Eric Bartlett, who I think was on a previous episode of your podcast. He was instrumental in helping me ease into the role. I still call him with questions, and he is very lovely about giving me his time. But I was very involved in the program before I started. So I was on the residency program committee. And so I did at least have some insight into how the program worked. I didn't have a full insight into the role, obviously, and all the things that Eric did behind the scenes that I wasn't aware of. But I did have a good understanding of what the role would be like. And at the end of the day, the biggest thing I like about the role that I have is being able to interact with the residents. It's the first time I've actually gotten to know them really well. When I was before I became program director, I would see the residents as they pass through breast imaging. And so not all of them would pass through, or, our schedules wouldn't align and I wouldn't get to know them very well. But I do meet with the residents individually twice a year, and then as often as people need to outside of that. And I do get to know them a lot better. And, they come to me for advice, and I feel like I'm able to give them some guidance or help them think about what is right for them in terms of future planning, career planning, and things like that. And so being an advocate for the residents, as well as hopefully being a mentor for them, those are the things that I really enjoy about my job.
So as a residency program director, you're now able to influence and impact the lives of so many residents who come under you, to mentor them and to guide them along the way. And for that, we're always thankful. Ladies and gentlemen, as Dr. Fleming pointed out, residency is like an apprenticeship. It is like being the sorcerer's apprentice. You get to learn, you get to work. It may be intense, but it is incredibly fulfilling, because on the other end, you come out as very well-rounded, established radiologists, which I do consider is very well-rounded magicians or witches and wizards. As I was telling you in the intro, medicine is like magic, but now it's all science. But if I did tell you that I could throw invisible beams into you and look right into you, what's going on inside you, doesn't that look like magic? Radiology residency is incredibly magical. Yes, it may be hard. Yes, it may be demanding, but it's incredibly magical and fulfilling. And if you're on the fence, I'd strongly urge you to consider it. And I'd strongly urge you to consider University of Medical Imaging Toronto and University of Toronto. Ladies and gentlemen, that was Dr. Rachel Fleming, breast radiologist and residency program director, University of Toronto, and me, your host, Satheesh Krishna. You were listening to Radiologists, a podcast by University Medical Imaging Toronto, the largest medical imaging group in Canada. Produced by Ina Levchuk. Learn more about us at universitymedicalimagingtoronto.ca and follow us on social media at Imaging Toronto. Thank you, everybody. See you on the next one.